This is Gabe Cook with Debate Kansas City, and I'm going to be talking to you today about our newest file release, the Healthcare Politics Disadvantage. We would like to thank the UMKC debate team because they shared a whole bunch of their evidence with us to create this file. And the rest of the evidence we found largely on the internet for free at the National Debate Coaches Association Open Evidence Project and at planetdebate.com. Both those websites will post files provided by summer debate camps for free. So we made use of that, compiled it all together, and now we have our healthcare disadvantage. And I will make one note that this particular file doesn't have the type of source citations that we normally do, because we just wanted to get a file together and out for you, and because this is intended to be more of a varsity release. So keep in mind that citations you might have to play with a bit. All right, let's get into the healthcare disadvantage. I'm going to give you an overview of the disadvantage and kind of the issues surrounding it, and then I'll take you step by step through it. So right now, healthcare is a huge debate in our country. President Obama has made it his absolute top priority. The Congress has been spending months on it. We've seen town halls. I mean, this is the big issue right now. So it's a really good one to bring up in a policy debate round. And what you're going to argue in this debate round is that healthcare is consuming all of the Congress's time. President Obama is putting all of his political capital behind it, and the affirmative plan is going to mess that process all up. It's going to be a controversial issue. It's going to cost Obama his political capital, and basically you're going to argue that the affirmatives proposal, that their social service poverty reduction plan, will trade off with healthcare reform. The status quo is going to give us healthcare reform. The affirmative is going to mess it all up. They're going to prevent healthcare reform from passing. And then you're going to argue that healthcare reform is a way more important issue than whatever it is the affirmative plan plans on passing. And there's pretty good evidence in this file that says healthcare reform is the best way possible to reduce poverty. So you can argue that you flipped the case, that you turned the case, because healthcare reform is going to pass in the status quo. That's going to solve poverty. If you prevent us from getting healthcare reform, you prevent us from really solving poverty. So you should stick with the status quo. So that's kind of an overview of the argument. Now let's check out the specifics. First thing you have with the file is the index page. And it just goes straight through and lists uniqueness arguments, link arguments, along with internal links and impacts. And then you'll notice in the middle, it switches and you have non-unique, link turn, impact turn. Keep in mind, that's the part of the file you'll use to answer the disadvantage. So this file has both the disadvantage and its extensions, and it also has the answers to the disadvantage beginning with non-unique. Now let's take a look at the disad shell proper. Subpoint A is the uniqueness argument with the disadvantage, and what this evidence says is that President Obama has put all of his political capital into passing health care, and he's actually going to get it done. And what the evidence says is that even the most conservative version of healthcare reform that's in the Congress right now, okay, because you have healthcare bills that exist in like 5 different committees, and those committees haven't had votes to determine whatever the final bill is going to be. So there's a whole bunch of different forms of healthcare legislation out there, and right now they're whittling it down to where they finally get to the one that's going to be the final piece of legislation. This evidence says that that final legislation, even if it takes the most conservative form possible, is still going to provide millions of people with health care insurance. It's going to get people with pre-existing conditions covered, and it's going to issue some other reforms on insurance companies that the evidence says will be good for the country. So the uniqueness evidence says even the most conservative health care that's going to pass is going to be really significant and help millions of people. Now, unfortunately, the disadvantage will contend that passing the affirmative plan will mess this process up. And there's 3 different link arguments, and one leads into another. Okay, first link argument. It's that poverty reduction programs are a controversial issue, that they're a losing issue politically. Typically, you would think that Democrats can make hay on poverty issues. That's more what the party's known for. But this evidence says that that's not true, that actually Democrats can't really gain any kind of political mileage out of poverty reduction programs, and that Republicans use poverty reduction programs as a wedge issue to sort of pull people apart. And so that means that in the end, the affirmative plan would be controversial. Nobody would really win from it. If anything, it would just cause fighting. So then that leads to the second leak argument, which is that controversial issues, which we just said the plan would be since it's a poverty plan, controversial issues destroy the president's political capital. And here's the explanation for that. If you're the president and you push through legislation, it takes time. Anytime you push through legislation, it takes time. You have to do some lobbying, you have to make some phone calls, you have to put your staff on it. If it's a controversial issue, it takes even more time. So the argument is that the affirmative's poverty program is going to be unpopular. And the only way that it would ever pass would be if the president put a lot of political capital into it. Here's the bad part of that, and here's the third part of the link. We can't pass health care without all of President Obama's political capital. So if the affirmative plan drains the president's political capital, he won't have enough left to get health care passed. Okay, so step it all back. Go back from the beginning. The argument is right now health care is going to pass. Even a really conservative version of health care is still going to help a ton of people. Unfortunately, the affirmative plan is going to be pushing a controversial issue. It's going to cost the president his political capital, and that political capital means, that loss of political capital means you can't get health care passed, which leads to the final impact. The final impact is that health care reform is the best way to solve poverty. And the evidence is pretty good on this point. It talks about how when people are out of work, they can't care for their children, they can't do a number of things to provide for a stable family. If they don't have health care insurance, if you're out of work and you don't have health care insurance, then you can't pay for a number of different things, and so it only pushes you further and further into poverty, and you have no way of getting out. So if you have health care reform, now folks will be able to have insurance even if they don't have their job. They'll be able to get their children medical care, and they'll be healthier, which means that they'll be more likely to be able to work and be productive. So all of these things will help reduce poverty a substantial amount. And you want to argue that health care reform will reduce poverty more than whatever it is the affirmative plan is doing. Now, you can take this disadvantage further at an impact level. There's evidence that says healthcare reform is key to stopping AIDS, and if we don't stop AIDS, it leads to extinction. Or you can find evidence that says we need healthcare reform to improve our vaccines, and if we don't stop the diseases that are spreading across the globe with healthcare reform, that can lead to extinction. Or you can find healthcare reform is critical to the economy, and if we don't get the economy in good shape eventually, then our economy will fall, other economies will fall, and that will somehow lead to a big nuclear war as well. These are all places that you can take the disadvantage if you want to get into great big nuclear war impacts. That's up to you. The big thing with the disadvantage is that you're going to have to stay up to date on the healthcare debate. The evidence says that healthcare reform will pass now, but that evidence is going to be outdated in just a week or two. So I would encourage that when you get this file, you look at it and you think about updating the uniqueness almost daily. A good politics site to go to is Real Clear Politics. You can also try Politico. And you can also use Google News to be constantly seeing what's happening on the healthcare debate. If you can find yourself a couple articles a day, you can stay updated and know where we're at in the process. This is a fluid argument, it's a constantly changing argument, and this is the first version Debate Kansas City has put out. We may put out updates throughout the year, but I would suggest to all of you that are considering running it to stay on top of the healthcare debate and to keep researching it. I hope this was helpful. I hope it gave you some idea of the politics argument and what it's all about, and I hope that y'all take care. Thanks.